Hi, I'm Debbie from Medstrom. I'm a member of the clinical team. We understand at the moment it's very difficult for us to gain access to help deliver training in the wards. We also understand that it's incredibly busy on the wards. So what we've tried to put together for you is a quick bite-sized 5 points in less than 5 minutes to help you. The human body has evolved to function optimally when we're upright about 16 hours a day and only lying supine about 8 hours a day. The effects that lying down permanently has on all of our body systems is important for caregivers to understand. We've included some resources for you to learn about each of these, or alternatively, we have an externally verified continuing professional development course on the consequences of immobility. The benefits of mobilisation of patients has been found in campaigns such as the End PJ Paralysis campaign. This campaign, when it was monitored, showed that there was a reduction in falls, a reduction in the length of stay, and a reduction in pressure ulcers and improvement in the patient's experience by mobilising patients early. In all, it gained the NHS 710,000 days by mobilising patients sooner. By using this button here, we could get the patient into a full upright seated position. This enables a patient who has previously been lying supine to get used to being more physiologically upright prior to mobilisation. To mobilise a patient from a recumbent position to a sit and stand position, we would use the mobilisation button here. This lowers the bed and brings only the head section up, providing no auto-contour so that the patient's legs aren't bent prior to mobilisation. Prior to mobilisation of any patient out from bed, it would be prudent to make sure that your mattress is auto-firmed. If you see that your patient's feet are not firmly on the floor, we would make sure that we use a tilt on the bed until the patient's feet are firmly based on the floor. To do this, always green to go, and then because our side rail is down, we're going to make sure that we disable the exit alarm by using mobilisation and mode. We'll then tilt the bed towards us until the patient's feet is on the floor. From this position, if we wanted to, we could also use the Mobi-lift so that the patient has additional stability when exiting the bed. We can use the bed to enable the patient to go into a more active standing position rather than a squat or crunch position. So in summary, we are designed to be upright. There are evidenced benefits to early mobilisation of patients. We can use an upright chair position to get patients physiologically used to being more upright after being supine. We can use a tilt position to make sure patients' feet are firmly on the floor prior to mobilising, and we can use the Mobi-lift feature like a bed lever to assist patients to exit the bed.